Hi, my name is Victoria Maskas, and my team members, Julia Cofino, Lauren Herwitz, and I will be discussing immersive virtual reality and its revolutionizing capabilities in medicine. We will be analyzing the impact of virtual reality and its role in both medical education and medical technology. Virtual reality, or VR, has increasingly played an integral role in the U.S. healthcare system since the 1980s. The rise of more advanced computing technology has spilled over into nearly every facet of medical training and practice. VR and its definition has been evolving as the technology has progressed. However, as of today, it can be described as a technology-based interface that can be used as a form of communication and as user experience. VR in medicine ultimately seeks to provide the user with an experience that parallels real clinical practice. Virtual reality was originally thought as a novelty of sorts, generally reserved as an adjunct to medical education. However, as the technology advanced, it became a more dominant form of how the U.S. educates its medical providers and also how trained providers practice medicine. For this reason, it is important to distinguish the roles of VR in both training and practice. An obvious benefit of virtual reality is that providers can practice in a no-risk environment and learn from their experience. A relatively new functionality is its ability to augment reality and aid in the clinical practice of its users. A surgeon may use VR to investigate the internal anatomy of a patient without ever making an incision. The diagnostic capabilities of virtual reality are in their infancy, but given its obvious patient safety features, it is sure to become even more prevalent in modern medicine. In the U.S. in particular, VR may hold the key to fixing a long-standing problem of rising healthcare costs. From allowing facilities to use remote clinicians via VR robotic interfacing to virtual visits with digitally based exams, it has a massive potential to reduce costs and increase efficiency for the healthcare of Americans.
While the use of simulations is nothing new to medical education, the ability to be fully immersed into these simulations presents a new world of possibilities. Fully immersive virtual reality can provide students with lifelike situations in order to not only enhance students' understandings and improve performance, but also assess their competence in these high-risk situations. In a study done at the University of New Mexico, researchers evaluated the benefits of VR on learning by observing the knowledge gain of 25 students before and after completing a VR simulation. Results from this study showed significantly high knowledge gains for those students who completed the fully immersive VR experience, demonstrating an overall positive effect of fully immersive VR simulations on learning. As the use of immersive VR expands into medical education nationwide, a new standard for measuring competence is arising. This improvement has the possibility to catch negligence before it even enters the medical field, thereby reducing malpractice and bettering the healthcare provided to Americans. Another study showed that compared with VR simulations, students who underwent conventional surgical training had been found to perform surgeries at a substantially slower rate and to be more likely to cause injury and damage to tissue. It is, although, important to note the limitations of VR, such as accuracy and efficacy. For example, the palpable properties and convex surfaces of the brain are very challenging to simulate in a virtual environment. So, while VR has certainly changed the game for medical education, it is still very new and needs improvement.
Virtual reality is not only used to help train residents, it's also used to help surgeons in the operating room by guiding them in the three-dimensional space, an alternative that is both cost-efficient and safe. Because VR has been proven to result in better success rates for surgery, using VR actually saves hospitals money when compared to the cost of having a patient stay longer due to complications. The Stanford Medical Center has recently utilized VR to highlight different components of the brain, such as arteries to show an aneurysm, bones to show skull deformities, or tissues to show a tumor, while rotating the view to illustrate how a tumor or aneurysm looks from different angles. Then, through the use of avatars, surgeons are able to go through the steps for removing a tumor or fixing an aneurysm, starting outside the skull. Additionally, VR can be used to immerse patients in their own anatomy by showing them a 3D model of their own brain or spine, allowing them to better visualize how their operation will happen. Overall, in the realm of surgery, VR provides surgeons with a real window into the actual organ of the specific patient they will operate on, as the 3D aspect of the imagery improves the accuracy of the surgery and provides a quicker yet safer alternative to the mental planning needed when practicing on a generic two-dimensional organ.
Here are some discussion starting questions. How would you test and/or quantify that a procedure done using VR is creating overall better outcomes than traditional practices? What things would justify not utilizing VR for a procedure, even if it is shown to provide statistically better outcomes? And how will interoperability affect the use of VR in medical practice? Thank you.